Well, the Children's Hospital Trust is hoping to raise 100,000 rand to improve child protection in South Africa, and it aims to develop the very first dedicated training centre to provide training and support to at least 60 healthcare workers per year across the Western Cape. Now, the project will provide optimal care to abused and neglected children and could even be replicated across the country in the future. Its CEO, Chantel Cooper, joins us now to take us through, of course, this amazing initiative. Chantel, thank you for your time and good morning to you. 100,000 rands, I understand that's your target that you're aiming to raise from generous donors. Tell me specifically what this money will be used for.
So just to emphasize that we are based at the Red Cross Children's Hospital, but also assist other healthcare facilities. And so child protection has been identified as a priority for the hospital because the social workers and the health workers flagged a serious concern that there's been an increasing number of children coming through the doors of the hospital who've experienced violence in different ways. And so the hospital realized, and the workers there realized, that there aren't adequate healthcare training opportunities for doctors and nurses to identify children who've experienced violence very early on. And so our goal is to ensure that we're able to, in partnership with the Red Cross Children's Hospital and the University of Cape Town, put emphasis on training, and our healthcare workers who have experienced the child care protection are going to train other health workers on how to identify children at early stages, not only to help them, but ensure they don't experience secondary victimization.
Right.
Because violence against children is a serious issue in our country.
It's a serious matter. I was discussing it with Gareth a bit earlier on, how the numbers are staggering around child killings, kidnappings, rape, trauma, psychological trauma as well involved. It is a concern. And you're doing this through your campaign, Chantel, I understand. Namely, I am every child. Can't you see that I matter? That question there, thought-provoking. How did you come about with this campaign name? And what are you hoping that it sort of sparks in one's mind?
You know, working in the child healthcare sector, we've realized that the larger focus of healthcare is on adults, and children's voices are lost. But I think what we need to realize is that our children are our future. And if we are hurting our children, I mean, Red Cross alone, just Red Cross in Cape Town, sees around 650 to 700 children a year who need medical intervention as a result of the violence that they have experienced. And so it's almost us trying to stand up and say, look, as one child matters, every child matters. And it's not just about us as children, it's about adults are responsible for the violence, and we as adults need to take responsibility because we need to ensure that we protect our children, and children are individuals and their voices need to be heard.
Yeah, and you're also saying they matter every day. I mean, even though we're commemorating 16 days of activism for no violence against women and children, you're saying this should not be limited to just 16 days. It should be an everyday commitment to protecting children. That's why I'd like to ask you, Chantel, about the project and its lifespan. How sustainable is it? Will this be a once-off? Are we seeing more years behind this project? But what are your plans?
So essentially, we're using 16 days of violence to launch the project. So the project initially will be over a period of 5 years. And your key question is sustainability. We want to make sure that this project will last until we have no need for the project, which is always a vision for all of us. But it is a unique collaboration between the University of Cape Town and the Department of Health through the Red Cross Children's Hospital. So essentially the starting point is to ensure that all health workers at the Red Cross Children's Hospital are adequately trained. The training will be created and accredited with the University of Cape Town. And so the vision is to ensure that every health worker, whether a nurse or a doctor, that trains to be a health worker undergoes adequate training to identify children who've experienced abuse, and what is the next step? What do I do? So if a child has come in with multiple injuries, what do I do? How do I know it's a child who's experienced violence? And who do I talk to? Where do I go? What's the next step? Because again, it's children can be identified in different areas of our society, different areas of our government systems, and we need to ensure that we provide the support and protect them as best as we can.
Well, I appreciate
So
you.
it's a 5-year period to start,
Right.
and then continue with all healthcare facilities.
Absolutely. Well, Chantel, as I mentioned, I appreciate you speaking to me about this. Chantel Cooper, Children's Hospital Trust CEO, talking to us about their campaign launched, and it's a very thought-provoking one. I am every child. Can't you see that I matter? One that will take over a span of, for as long as we don't need to have such campaigns anymore. And of course, that appeal being made to anyone to come on board and also join in the cause, support these children, or support the project to ensure that healthcare workers have sufficient training to handle cases where a child has experienced training. Thank you so much, Chantel Cooper, for speaking to me this morning.